Let me officially welcome everybody to the NIDA International Forum. This is our third day and our third session. Today we decided to try to have some more participatory activities and invite you all to come and give us brief presentations on your research and your research findings. So again, thank you for that. I will do the introductions and we'll get started right away. And I think I learned how to pronounce Joao's name a few minutes ago.
Thank you.
So we're going to start off with Joao Mauricio Castadelli Maya, who is a current NIDA Invest Fellow with Dr. Sylvia Martins at Columbia University. He's an auxiliary professor of psychiatry at the ABC University Center in Sao Paulo. And on Tuesday, he received the award for excellence in clinical work by a postdoctoral researcher at the CPDD Early Career Research Presentation Competition. So we're very excited and proud of you for that, Joao. His presentation today is Substance Use in Mild COVID-19 Patients, a Retrospective Study.
So thank you so much, Stephen. And your pronunciation is very good. I just say that you learn it quickly. And today I'm going to present on substance use in mild COVID patients. It's a retrospective study with a Brazilian sample of patients. So in this study, we aimed to investigate differences between pre and post-COVID substance use. If pre-COVID substance use was associated with increased symptoms and also with specific symptoms, or if COVID-19 severity was associated with post-COVID substance use. And finally, if we had changes between pre and post-COVID substance use in terms of any kind of associations or new paths through the disease. So we are, in this study, we are using a sample of almost 1,000 individuals who were classified as mild cases. We reached a little bit more than half of all the patients that were followed in a middle-sized Brazilian city. It's São Caetano do Sul. And we were able to assess all the CDC COVID-19 symptoms during the active phase of the disease, which could be like up to 14 days. And we did a unique online survey in which we assessed frequency of substance use in 3 different time points. So the month before COVID, the month just after COVID, and the month just before the survey. And we did use a different statistical analysis depending on the aims of the study because we had different outcomes. So what did we find? We found that the levels of alcohol and tobacco decreased in the month just after COVID, and the levels of non-medical use of analgesics increased in the month just after COVID, which is a little bit intuitive. And these levels went back to the pre-levels in the case of non-medical use of analgesics and tobacco. For alcohol, it went back to a level which is intermediate between pre and post-COVID, but higher than the post-COVID period. We were not able to find any association between previous levels of COVID, of substance use, and symptoms of COVID or severity. We didn't find also any association between COVID severity and post substance use. However, which were the aims 2 and 3. However, in the aim 4, we found here that all the previous use of substances were associated with post-use of a given substance, and found new paths in which we found people who previously used alcohol. The previous levels of alcohol use were associated with post levels of non-medical use of analgesics. The previous levels of non-medical use of analgesics were associated with post levels of benzodiazepines and also cannabis. And previous levels of tobacco was associated with post levels of cannabis, and also pre-levels of benzo with post levels of non-medical use of analgesics. So we had, in summary, we had new paths for cannabis, non-medical use of benzodiazepines, and non-medical use of analgesics. So in the conclusion, we didn't find specific associations between previous substance use and COVID symptoms or severity, which was our main question, and neither association between COVID severity and post-substance use. However, it's important to educate people for prevention of non-medical use of analgesics during the more active phase of COVID, and more importantly, to increase the perceived risks of cannabis, non-medical use of benzodiazepines, and non-medical use of analgesics in the post, more lately in our case, it was in the press survey period, because we had especially these people.
5 minutes.
We have especially these people who are at risk, which are the previous substance users for at risk for new paths for this substance use in the lately period. So thank you for my collaborators, for my funders, and also the city of São Caetano.
Okay. Thank you very much. Just a quick question about your plans to do any additional follow-up surveys.
Yeah,
long-term COVID. People are talking about the effects of long-term effects of COVID and so forth.
Yeah. We are just me and Sylvia and people from São Caetano. We are just following up these people not only for substance use, but also for depression and anxiety, which is something that is really a hot topic right now. And yes, so the question is yes, and we don't have many results yet, but we are doing it.
Very good. Thank you so much. Okay. Moving along, our second speaker is Anna Goodman, who's a research and policy analyst at the Canadian Centre on Substance Use and Addiction, where she focuses on impaired driving, cannabis, and youth substance use prevention. And the title of her talk today is Canadian Perceptions and Experiences with Virtual Services and Supports for Substance Use. Anna, welcome.
Hi, good morning, everyone, or good evening, or good afternoon. Thank you, Steve. Thank you for having me here today. So today I'm going to be presenting some results from a mixed methods study that we just completed at CCSA. But before I get started, I just want to very quickly acknowledge the partnership that made this possible. So we had folks from the Royal Ottawa Mental Health Centre, Canadian Psychological Association, as well as Canada Health InfoWay. So what did we do? So back in May 2020, we had a need identified by many of our partners regarding a gap in data in terms of this switch from in-person services to virtual care. So a lot of our folks who are using substances or experiencing substance use disorder or concurrent disorders, they had that very rapid switch to virtual care in order to accommodate COVID-19 restrictions. And it was very important for us to understand how this switch was going. How are people receiving this new technology? Are there certain groups that might be sort of left behind with this switch? And how are our practitioners experiencing this switch as well? So our objectives were to understand both how the clients using virtual care were receiving it, and how our practitioners were experiencing it. And we wanted to look at virtual care on a large spectrum. So we looked at everything from texting and apps and going online and accessing education through to virtual treatment through your phone or your Zoom or whatever it might be, all the way through some really innovative programs that were being delivered online, such as harm reduction programs. So we wanted to ensure that this was included fully. So we ended up conducting a quantitative survey. We had over 1,000 people living in Canada that responded. Only about 300 of them were actually using virtual services for these reasons. And then we also just spoke to the general public at large to find out if this was something that they would be interested in using in the future in case we want to scale these services up further. And we also did 14 interviews with practitioners who were delivering virtual care. So what did we find? We had about 2/3 of the clients being satisfied with virtual services, but only 48% actually said they would prefer to remain using virtual services. The rest of them wanted to go back to in-person care. And this was echoed in our qualitative findings as well. So those practitioners delivering the virtual care felt that it's not as effective as in-person care. And that's understandably related to having that rapport, getting those physical and social cues, and creating that connection between client and practitioner. We knew technology was going to be a large theme, and this did come out in both the quantitative and qualitative results. So we found that those people who were more comfortable with technology were more likely to be comfortable with virtual care. So not surprising, but important to consider those that maybe aren't as technologically advanced, might not be as happy with this switch. And our practitioners also reported a very steep learning curve for both clients and themselves when switching to virtual care. So we asked about a lot of barriers to accessing services or to using virtual services. And these very much varied based on gender, race, age, and geography. So for example, our women were more likely than men to be less satisfied with virtual care. So we had the women expressing that they would want to go back to the in-person care, whereas men were a little more comfortable with remaining virtual. And then age came out as a huge factor as well. So those aged 34 to 54 were more likely to report privacy as a barrier to virtual care. So we figured this might be because you have children at home or roommates or whatever it might be. And those over the age of 55 were less likely to think they could build a relationship with a healthcare provider virtually. So they kind of had less faith in creating that relationship online. And a big theme that came out with our practitioners was that certain populations aren't able to access virtual care in the same way. So we're thinking marginalized, those who don't have access to the internet, those remote rural folks, they might be left behind in this switch. So just quickly, I'll end with our implications of this work. So post-pandemic, we really want to ensure we have a hybrid approach. So offering both in-person and virtual services, and making sure we're looking at different ways of tailoring our programs based on demographics, and maybe considering investing in providing technology and internet to certain populations. That's it. Thank you.
Thank you. Could you just say a word about how or if the type of service delivered might have impacted the satisfaction levels?
So a lot of folks reported different types of service use. So we had folks using both their phone and their online. I think some of the older populations were less likely to use like apps and like more kind of technologically advanced things. And then we had the younger folks more comfortable with using video. So it kind of, again, based on the demographic, would vary.
And what do you see the future of this? I mean, so much of what we've done over the last year and a half is about, we've done every aspect of life has become virtual.
I know.
Yeah. Do you see a growing future and I would assume so, but what are your thoughts on it?
So that certainly was one of the key reasons we were actually asked to collect this data, is we have certain governments interested in scaling this type of thing up. We talk a lot about the fourth wave or whatever it might be regarding mental health and increase in substance use. And, are we going to need creative ways of really providing these services to those who need them the most? And I think that there is, there is a lot of use in providing these services further, even beyond COVID.
Right, very good. Okay, thanks a lot. Next presentation is by Sarah Morhart, who's a doctoral student in the Faculty of Health Sciences at Simon Fraser University, where she's evaluating innovative and low threshold health and social support models for sex workers. And the title of her paper today is Changes in Illicit Drug Supply During COVID-19, Findings of a Community-Based Cohort of Women Sex Workers in Metro Vancouver. Yes, Sarah.
Thank you. Good morning, good afternoon, good evening. I love that introduction.
Yeah, I think we're probably 15 time zones.
I love it.
Yeah.
Thanks. Thank you for having me here. Today I'm presenting preliminary work on the impacts of the COVID-19 pandemic and the opioid poisoning epidemic on overdose prevention and risk amongst sex workers in Vancouver. So to begin, I just wanted to quickly acknowledge the study participants and community collaborators for their contributions to this research, as well as current and past researchers and staff. The study is supported by the U.S. National Institutes of Health. I also wanted to acknowledge that I'm speaking to everyone today from the traditional unceded territories of the Matski, Kwantlen, and Katzie First Nations. So I'm drawing on cross-sectional data from a novel COVID supplementary questionnaire that was asked of participants enrolled in an open perspective community-based cohort of over 900 indoor street-based and online sex workers called Aisha that's been running since 2010. Eligibility inclusion criteria includes women, cis and trans inclusive, age 14 and older who have exchanged sex for money in the last 30 days. Recruitment, retention, interviewing is done by outreach via a frontline team comprised of former and current sex workers, as well as community-based staff. The COVID supplement was developed to quickly capture the experiences of sex workers during the pandemic. Amongst questions around health, safety, and changes to working conditions, we also asked questions related to sex worker substance use. Our study objective was to investigate patterns and associations with experiencing negative changes to illicit drug supply among sex workers who use drugs during COVID. Bivariate and multivariate logistic regression was used to investigate correlates of natural negative changes to drug supply. So when referring to our outcome variable of reporting negative changes to illicit drug supply, we're describing reports of changes which respondents identified as unwanted or harmful to their usual supply of illicit drugs. These changes may be the availability of illicit drugs, the quality of the illicit drugs, or the accessibility of illicit drugs. A major consequence of both COVID and the ongoing opioid poisoning epidemic is that the illicit drug supply market is tainted. People simply do not know what's in the drugs that they're buying in the illicit market. This outcome is important as it reflects the increased risk women sex workers face in their consumption of illicit drugs. These negative changes could lead to decisions to accept or consume drugs that are potentially more harmful in conditions and contexts that are potentially more dangerous. It also highlights that interventions and measures put in place to mitigate drug-related harms are poorly equipped to respond to the needs of women and sex workers. So a total of 179 sex workers completed the supplement between April 2020 and April 2021, with over 68% of respondents reporting a negative change to their illicit drug supply. And just over 20% had accessed government-regulated prescription saver supply. At the bivariate level, we saw statistically significant associations between the outcome and reports of accessing overdose prevention sites, experienced barriers to healthcare in the last 6 months, and injection drug use in the last 6 months. In multivariate analysis, higher odds of reporting negative changes to illicit drug supply is found amongst women who inject drugs, as well as those reporting barriers to healthcare. Marginally higher odds were associated amongst women accessing overdose prevention sites. So we're still learning about the gendered experience of sex workers and substance users during COVID. We do know that criminalization and displacement of sex workers contribute to minimal healthcare access, and that sex workers are disproportionately overrepresented amongst people who use drugs. Additionally, the tailored gendered impacts needs of women, sex workers in harm reduction and other health and safety related spaces are not considered, as these spaces and supports tend to be male oriented and are especially dangerous for women facing the overlapping stigmas of substance use and sex work. In the context of COVID, many sex workers have had their incomes decimated and their access to health and social supports severely reduced or eradicated. Sex workers and women who use drugs are profoundly impacted by ongoing criminalization of both sex work and punitive drug policy. Our results showed that an alarmingly high proportion of sex workers who use drugs experienced negative changes to illicit drug supply during COVID. Mitigating the negative impacts of the overlapping public health crises requires critical investment in sex worker and women-led interventions. Informed policy recommendations should recognize that sex workers and women who use drugs are informed in risk mitigation and are making use of services like overdose prevention sites and drug checking services, despite these sites not being well adapted to their needs. Opportunities should be seized to integrate drug user-informed scale-up and integration of prescription safer supply at overdose prevention sites, as this also represents a moment to re-engage in healthcare. Thanks for your time and our interest in our community-based study. We're going to continue to examine these impacts to provide evidence-based in calling for further community-based and peer-led services and interventions that directly impact our communities. That's all.
Great. All right, thank you very much. One thought occurred, or question occurred to me is, so what was the exact timing of the survey, and what's your sense of what might be happening as the pandemic hopefully is fading, over time?
Great question. So previous to this, I was the research coordinator for that study. As soon as we heard in Vancouver, BC, where I'm based, March 14th is when the public health announcement was around COVID. I spent the next 2 weeks developing this supplement. So we got it up and going, and we started asking our participants virtually these questions. I believe it was April 6th. And so we did 1 year collection from that date. Post-COVID, we're still in the throes of an opioid poisoning epidemic here in Vancouver, BC. Here in the province of BC in Canada, where I'm based, we have 5 to 6 deaths a day still happening. There was a slight dip in that number of deaths per day in 2019, but come 2020, we're still seeing these impacts. So, what that's really saying, and I know this is familiar to everyone in this room, is that the drug supply is tainted. People simply don't know what's in the drugs that they're buying. The government here in Canada and in BC has, kickstarted this prescription safer supply, but there's some real major problems around being able to even access it, the availability of drugs on it that are available for people on it. And that simply, people just the stigma, the level of stigma for people who are using substances, we're missing huge swaths of the population. So I don't see this problem going away.
Okay, thank you very much. Next speaker is Ada Busalea, who's a research assistant at the Addiction Research Center, Alternative Georgia, where she focuses on harm reduction approaches, drug use in nightlife settings, young recreational users, new psychoactive substances, and gambling. And the title of her talk today is Monitoring an Online Illicit Drug Market During COVID-19 in Georgia. Welcome, Ada.
Thank you. Hello, everybody. I'm happy that I have opportunity to present study findings with you all, which was about monitoring an online illicit drug market during COVID-19 in Georgia. Matanga is a major online illicit drug market that offers a wide selection of psychotropic drugs for procurement in Georgia. The purchased drugs can be collected at specific locations as a hidden dead drop in 5 cities of Georgia, as you can see on the map. The aim of our study was to examine trends in illicit drug sales on Matanga during COVID-19 restrictions. As for methodology, locally developed software was used to monitor and record transactions on Matanga over the period of April-September 2020 for 6 months. And this software consisted 2 parts, scraper and exporter. The server ran the scraper each hour, collected and saved all relevant product information, and the data was cleaned manually, and items were grouped in unique categories of substances. Information that was not relevant for drugs was filtered and deleted. For example, there were some announcements for courier vacancies and so on. As for results, 22,000 sale transactions were made during this study period, and total revenues exceeded $4.5 million US. 19 categories of substances were offered and sold during these 6 months, and the average number of daily transactions were 132. Cannabis product sales accounted for the highest value of sales and for the largest numbers of transactions as well, as you can see on the graph. And after cannabis, cocaine was the most often sold substance and was followed by MDMA ecstasy. And in terms of revenues, cannabis was followed by cocaine and methadone largely was in crystal form. MDMA, ecstasy, heroin, alpha PVP, methamphetamine, and N-bone were also sold in relatively large amounts. And what else also worth to mention was that daily offers and daily sales were vastly equal throughout this studied period. Unfortunately, we don't have data about monitoring illicit drug markets during pre-COVID periods that we can compare to COVID period time. And for conclusions, to conclude, despite COVID-19 related restrictions, the Matanga platform was actively used to purchase drugs in Georgia. And for limitations, since the scraper software ran hourly, it would potentially miss transactions if the product was placed for sale and was actually sold within a single hour. It was also not feasible to track and account for discounts that were given to individual customers, as dealers offered some discounts to regular customers who had at least 5 episodes of buying drugs on their website. Also, the Matanga market discontinued from June 23 on its old web address, and we research team was able to identify a new address by July 14. So the data presented did not include transactions for the period between 23 June and July 14. Thank you for your attention and waiting for your questions.
Yes. Thank you, Ada. So first question is this website, Matanga. This is an illicit website, correct? I'm just curious of how it can operate. But I mean, was it shut down by law enforcement or?
No, actually, it's not Georgian website. It's mostly in Russian language, and there are some product names also in English, but it's not Georgian. So Georgian law enforcement is unable to do anything against it.
I see. And then I noticed that there was like a large peak, it looked like, in sales in August, very large. I don't know if you had any thoughts as to why that happened.
Yes, in August, there were largest transactions. But unfortunately, we don't know reasons for this. And in July, for example, to compare was the lowest transactions, and we are unable to explain these results.
Right. And the drugs must all be delivered through?
It's in advance, it's hidden in some locations, for example, in forests outside the city or somewhere, or in old buildings. And after payment, users get the exact coordinates or photos where their drugs are hidden, and they are going and collecting their drugs there.
Yeah, okay. Very interesting. Yeah, very nice paper. Thank you so much.
Thank you.
Okay. Our next speaker is Judith Ferrar Alecram, who's a psychologist with the Mexican Observatory of Mental Health and Drug Use at the National Commission Against Addictions. And her talk today is Drug Use Patterns in Mexico During the COVID-19 Pandemic. Welcome, Judith.
Thank you. Hi, everybody. I'm Judith, and let me tell you about my study. Well, due to the COVID-19 pandemic, the Mexican government implemented preventive measures to reduce the risks of contagion. However, self-isolation measures could bring about change in drug use, giving the barriers to drug trafficking and the increased risk perception of drug use. The aim of this study, sorry, I don't share. Well, the aim of this study was describe the patterns and the drugs use patterns in Mexico from the declaration of the COVID-19 pandemic. Well, we worked with 700 to 2,067 people, mainly women. This study was made in collaboration with the Inter-American Drug Abuse Control Commission. We use a self-administered survey remotely through the SurveyMonkey platform. And we share the survey in the 32 states of Mexico. So, the results show since the pandemic began, 48.3% of the participants work or studied at home. 39% of the participants must go to work. In drug use, people indicate that in the last year they had consumed alcohol, tobacco, and marijuana. In addition, the 59% of illegal drug users report that they had stopped their drug use during self-isolation. And although 44% of the participants stopped marijuana use, and 10.4 of them increased marijuana use. Yeah, we see. On the other hand, in the participants who increased their drug use, the main reasons for increased their use were anxiety, stress, and self-isolation measures. On the other hand, in addition, 5.4 of the participants mentioning that was hard for them to get their drugs, and 9.6% of the participants obtained illegal drugs. In conclusion, the pattern of the alcohol and tobacco use remained the same, while the use of illegal drugs decreased. However, there are a proportion of people who increase their use of alcohol, tobacco, and marijuana. Likewise, anxiety, stress, and self-isolation were the main cause for people to resort to drug use during the pandemic. We have challenge in helping people control their emotions and the other situations that lead to drug use. In the context of COVID-19, it will be important to help drug users control their emotions in the face of self-isolation. Thanks.
Thank you very much. Is there a plan to do another survey or continue this survey? Do you plan on doing that?
I'm so sorry, I don't listen.
Sorry, me to say the question again. Can you hear me?
Yeah.
Yeah, yeah. I'm just wondering if you're going to repeat the survey in the future.
And the survey in the future.
Yeah.
We will make the survey in September, October this year, and compare the results of the people. Yeah.
Yeah. Okay, good. Well, I look forward to hearing more about your data in the future. Thank you very much.
Thanks.
Okay. Our next speaker is Dr. Bisma Damiri, who's an associate professor at the National University in Palestine, where she coordinates the master's degree program in clinical research. And the title of her talk today is Depression Among Medical and Non-Medical Students and its Association with Cognitive Enhancers and Psychostimulant Use During COVID-19 Quarantine. So, welcome, Bisma.
Hi, everyone. I am talking on behalf of Basma Damiri.
Okay, Ahmad, yes, welcome.
Hi. All right. Just one second. University students experience higher rates of depression compared to general population, and that was observed here in Palestine, and it was mentioned in several international publications. Due to social and political problems, the use of cognitive enhancers and psychostimulants is highly prevalent among Palestinian population in general and university students in particular. However, depression among cognitive enhancer and psychostimulant users was an under-recognized and neglected health issue in the previous national studies targeting university students. Therefore, this study aimed to investigate the prevalence of depression and its association with cognitive enhancers and psychostimulants among university students in the West Bank, Palestine, during the COVID-19 pandemic. We focused in this study on comparing the differences between medical and non-medical students in terms of prevalence of depression, severity of depression, and the frequency and pattern of cognitive enhancers and psychostimulants use. As for our results, cigarette smoking was highly prevalent among university students, where about 39.2% of males were smokers. And it was also associated with all levels of depression, severe depression, moderate depression, and mild depression. It was mostly associated with severe depression. Tobacco alternative products such as water pipe and e-cigarettes and energy drink consumption were all highly prevalent among university students. We observed male predominance in tobacco and energy drink consumption. However, the gender gap between males and females in water pipe smoking was narrower than that in cigarette smoking. No association was found between depression, water pipe, e-cigarettes, energy drinks, coffee, tea, and chocolate. Medical students were less likely to have severe depression compared to non-medical students. Moreover, males were less likely to have moderate depression and mild depression when compared to females. Finally, the most prevalent motivations for substance use were curiosity for cigarette smoking and energy drink consumption, fun for water pipe smoking, increasing wakefulness and improving vigilance and attention for energy drink, coffee, and tea consumption. About 10% of smokers chose COVID-19 as a motive for smoking. To conclude, overall, the results of this study revealed the high prevalence of depression and the terminal effects of smoking on university students. Moreover, they suggest the urgent need to address depression and its risk factors among Palestinian university students by educating students about mental health, identifying high-risk students, and offering easily accessible psychological help. Finally, our results prompt the need to broaden the spectrum of future studies to include students from various academic fields instead of only focusing on medical students. Thank you for listening.
Oh, thank you, Ahmad. want to commend you for doing a very nice study during difficult times, and just wanted to know if you had any what's going on now, or what are your future plans?
You mean
In this vein, in terms of doing this kind of research
uh,
on substance use in the students?
I think we will conduct similar research after the resolution of COVID-19 era, so that we can compare the results during COVID and post-COVID, and that will give us more definitive answers about the exact effect of COVID-19 on cognitive enhancers and psychostimulant consumption.
Okay, thank you very much.
Thank you.
Okay, our next speaker is Adrian Abagu, who's a longtime friend of the NIDA International Program. He's a former NIDA Humphrey Fellow and is currently senior physician in the infectious diseases at the Romanian National Institute for Infectious Diseases and the medical coordinator of the ARENA Opioid Maintenance Therapy Center. And the title of his presentation today is "Why Are Injecting Drug Users and Patients in Methadone Substitution Protected from SARS-CoV-2 Infections?" Welcome.
Thank you,
Adrian.
Steve. Hello to everybody. And I will share with you, I think it's okay. So already after the first 6 months of the COVID pandemic, we have seen that far less patients in methadone maintenance or attending needle exchange programs were infected with COVID. So in November 2020, at the ISEM virtual meeting, I have asked many other participants, and they say that this was seen also in other countries. So for the 11 months of the pandemic in Romania, with a population of a little more than 19 million, we have a prevalence of COVID-19 registered cases about 3.7. In Bucharest, where the more than 95% of the problematic drug users are settled, we have even higher prevalence with 5% of COVID cases, but this is also that more tests were done in our capital, where a lot of the laboratories for detecting PCR are situated. Looking in the 1,600 patients in the 9 methadone centers in Bucharest, and we have methadone centers sadly only in Bucharest, we have a prevalence of 0.87, and in the clients reaching the needle exchange programs, which were for the 11 months almost 3,000 individuals, the prevalence was 1.2. So at least 4 times less than in general population. We were looking, in the general population, we have almost 54% women affected, but the death toll was almost 16% in men, and with very few cases in special population. For women, women are representing 24% of the patients in methadone maintenance and 43% among men. Analyzing in the COVID cases we had the methadone dose, we see that 86% of them were on lower doses, less than 60 milligrams. And analyzing patients attending needle exchange programs, though the people who got ill, almost 2/3 were on both heroin and new psychostimulants. Actually, they are most on psychostimulants, but they use heroin to can sleep, and were only on new psychostimulants. So I was able to think for an explanation to this situation, looking the letter to the editor of the European Journal of Psychiatry in the beginning of 2021, a letter written by Attademo and Bernardini, two Italians, who have shown they were discussing the neuronal pathology, psychopathology in COVID infection. And they have shown that there is a significant link based on gene co-expression and co-regulation and thus function between the angiotensin-1 converting enzyme, the AC2, which is encoding the main receptor for the spike of COVID, and dopa decarboxylase, DDC, encoding the enzyme that catalyzes the biosynthesis of dopamine, serotonin, and histamine. Furthermore, it was shown that these two co-express and co-regulate also in non-neuronal cell types. And it was found that in patients with Parkinson, which are characterized by dopamine deficiency, they have found there were fewer cases of SARS-CoV-2 infection. Actually, like in children who also, because they have fewer AC2 receptors, this is why they are less infected. Or in people with drug dependence, it is well known that there is a significant depletion of dopamine receptors, not only at brain level, and the dysfunction of serotonin and its metabolite melatonin. So I think this is why it's a protective effect, because they also have less SARS-CoV-2 receptors, and this is why we can explain the prevalence. Thank you.
Wow. Okay. That is very, very interesting work. And I want to make sure I understand what you're saying. So you're saying, in general, drug users and others, of Parkinson's patients, for example, who show reduced levels of dopamine, reduced receptors, are at reduced risk because of this interaction.
They
and
also
the regulation.
have reduced numbers of AC2 SARS-CoV-2 receptors.
Yeah, so there's
are co-regulated.
Right. Okay. So would it make sense? Is anybody looking at any other ways of reducing dopamine function, for example, as a way to prevent or treat SARS? This sounds extremely provocative and potentially important. I don't know how one would do that, because most of the drugs that I'm aware of would increase dopamine function, not decrease it. What are your thoughts on that?
It is the increase is at the beginning of use. After that, you have a depletion.
Decreasing, yeah.
Decrease.
Yeah.
And most of our patients are a year after year using heroin or methadone or both almost at the same time.
And you said, I think, that you heard that this was happening in other countries. You heard at
Yes, so I have put this question: why do we have fewer cases? And no one was able in the ISEM meeting to answer. So
this sounds like a topic worthy of follow-up, doesn't it? I look forward to it'd be nice to see a multi-site study of this, to see these results elsewhere. Very, very interesting. Okay. Thank you very much, Adrian.
Thank you.
Okay. Our next speaker is Colleen Dell, who's a professor at the Centennial Enhancement Chair in One Health and Wellness at the University of Saskatchewan, where she examines how the human-animal bond can help enrich wellness among individuals and communities in settings, including addiction treatment facilities, criminal justice institutions, and universities. And the title of her talk today is Examining Changes in Post-Traumatic Stress Disorder, Symptoms and Substance Use among a Sample of Canadian Veterans Working with Service Dogs, an Exploratory Longitudinal Study. Hello, Colleen, and welcome.
Hello, thank you so much, Steve. I want to start by acknowledging the land, any animals you might have around you, such as some dogs, and yourselves for being here. I was to have EJ with me. He's a service dog in training, but it's really early here in Saskatchewan, Canada, so he's sleeping, and I just didn't have the heart to wake him up. So, all right, I'm here alone. So these are my research questions. Do Audiamus, and this is the service dog organization I work with that EJ's actually being trained through. So do Audiamus service dogs assist veterans diagnosed with PTSD and addressing problematic substance use? And if yes, how so? Accounting for both the bond that individuals have with the dog, as well as the tasks that the dogs are trained to perform. So for those who are not aware, service dogs are trained to perform a variety of tasks for veterans with PTSD symptoms, such as, for example, waking a veteran out of a nightmare. And a lot of the veterans we know who are diagnosed with PTSD are at elevated risk for substance use or problematic substance use. So that's where we've put our emphasis. So this study that I'm going to talk to you about is a patient-oriented project. It involved a really large team made up of veterans, service dog trainers, students, researchers, and so forth. And all of us were involved in training a service dog in some way. I trained a full service dog, unfortunately passed, and now I'm training a new one. And that's really important to our team that we get the best understanding that we can. So data was collected with 5 veterans over a 1-year period. We measured substance use and PTSD at 6 points. So baseline, 1, 3, 6, 9, and 12 months. And our research addresses a criticism in the literature, and that is that there's not enough quantitative methods. So we did a mixed methods, quant and qualitative. And just note that research continues to emerge in this field. It's a really new field. Whoops. So our analyses included a reliable change index and descriptive statistics for the PCL5 and the DUCY, and a content analysis for one-on-one structured interviews. So reliable change index is useful for measuring clinically significant changes as well as statistically significant changes when you have a small sample size. The PCL5 is a post-traumatic stress disorder checklist for the diagnostic and statistical manual. And the DUCY revised version is a drug use and screening inventory revised substance use scale, which most people here were aware of.
Colleen, I don't know if you know it, but the research questions slide is still up.
Oh, sorry, thank you.
There you go.
Okay. So comparing group baseline and 1-year means for the PCL5 and the DUCY, and what we put up here was the DUCY behavior pattern subscale because it measures PTSD symptoms similar to the PCL. So we just put this one up here as well. And we found that the RC, or the reliable change index, effect size scores suggested a clinically significant decrease in PTSD scores and symptoms. And our interviews complemented these findings. 3 of the 5 veterans reported a change in their PTSD symptoms. They had fewer nightmares, less hypervigilance, and more focus as a result of their service dog. And then now looking at the DUCY, which might be of more interest to everyone here. So the DUCY revised substance use scale changes were not significant, as you can see on the graph here, using reliable change index. But during the interviews, the veterans reported a decrease in their use of opioids and alcohol, while some reported an increase in their medical cannabis use, which some may argue is not necessarily a bad thing if opioid use was going down. So veterans also shared, and this is important to note, how service dogs sometimes contribute to an increase in their PTSD symptoms and related symptoms and substance use. But this was specifically early on when they were bonding with their dog, and for some of them, they were training with the dog. So this did come down, but sometimes there was increases in the beginning. So overall, service dogs can be a complement to treatment. At least we've starting to find that, and there are some benefits to veterans diagnosed with PTSD. I think a challenge is going to be using some of the standardized instruments because they don't really get at what's happening between that veteran and that dog. And that's where the interviews really come in, and where we start to recognize the importance of that bond, of a non-judgmental support, Some say spiritual growth, or starting to even speak to moral injury because you have somebody, a living being that is not judging you and you are connecting with, when people are the veterans are so disconnected from society. So we definitely need more research. And again, not just looking at the technical skills that the dogs do, which are amazing, but also that bond that the veterans have with them. And then also starting to interview, and we have started, spouses and service providers and family members of the veterans to get a more holistic understanding of the impact of these dogs in their lives and their families as well.
Good, thank you. Let me ask you too about your future plans. I mean, do you have other projects underway or planned, or?
Yeah, it's interesting because I think with what I'm seeing now, being in this area for, I think, 7 years, we also offer dog programs in prisons with with prisoners who have substance use disorders. We work in lots of different environments, and I'm just seeing more and more this, the filtering or the same themes coming out amongst the different populations. So where I see this going is pulling a lot of that together. And kind of the future vision is also looking at the role of companion animals in the lives of individuals who are struggling with problematic substance use, because it's not just a trained animal, but it's our relationship with animals and our relationship with environment. So much more holistic look at well-being for humans.
Oh. Excellent. Well, thank you very much and good luck. And thank you for getting up so early. I think you get the award for that with the group today. Okay, our next speaker is Dr. Daniela Ocana Gordillo, who's a former NIDA Humphrey Fellow from Ecuador. She's working on her master's degree through the International Program in Addiction Studies, which we heard about on Tuesday. Danielle is currently a US-based sociologist with the Paramuta Chia Consultancy. And the title of her talk today is Correlates of Marijuana Use Problems in a National Sample of Female Ecuadorian Students. Welcome, Daniela.
Thank you, sir. Good morning to everyone. Good night. Good any time of the day or night we are. So first of all, I would like to acknowledge also Dr. Wendy Cleaver, which is an attendee, but that worked with me in this study. So both of us were hard working on this. So thank you so much. I'm going to talk right now about correlates of marijuana use and problems with use in a national sample of female Ecuadorian secondary school students. This was conducted in 2016. It was a nationally representative sample with more than 34,000 effective surveys. It was the methodology was used. It was a self-reported questionnaire, and it was representative for all capital cities and cities with more than 30,000 inhabitants, and only for the urban area. It comprehends a population of students from 11 to 18 year old. So what were the measures that were taken into account in the study was lifetime use of marijuana and problematic use of marijuana with 6 questions. We also assessed for risk factors, ease of access to marijuana, peer substance use related to alcohol, tobacco, and marijuana. And then promotive factors were assessed for parental monitoring, family engagement, and perceived security around schools. We conducted several statistic operations. So first of all, for lifetime marijuana use, we conducted a binary logistic regressions where we had important contributions and independent contributions for age, ease of access to marijuana, friends tobacco use, friends marijuana use, parental monitoring, and perceived security, which of course was important to take in account for considering that it's a population that is some important vulnerability because of gender and because of the age of the population of the study. Then for problematic use of marijuana, aside of the other variables that we were analyzing in lifetime use, the sole contribution was that frequent use of marijuana in the past year and a greater number of friends who use marijuana were the two variables that predicted problematic use of marijuana. And we also took in account for this linear logistic regression, age and frequency as covariates. So as you can see in here, which is interesting about this study was that once the girls start using marijuana independently of the age, the sole predictor for problematic use was peer use of marijuana, and also of course frequency, but that's something that it's obvious. To talk about key results of the study, the risk of ever having used marijuana was associated with factors at different levels, although age was not a specific factor to take in account. Influence of risk and promotive factors did not differ by age, which was also a finding that was interesting. And then that what I already said, that once girls begin marijuana use, peer use was the sole predictor for their problematic use. We also saw that there were several limitations for this study, of course. Of course, it was because of the cross-sectional design, which limited how to establish how in time the variables behave. There was also a weak parental monitoring scale, which we had to construct with different indicators, and also there were not considered other key factors for marijuana use and problematic marijuana use, like trauma exposure, adverse childhood experiences, or promotive factors like emotion regulation and other variables like this. So all in all, what we concluded is that if once girls have started using marijuana, it is important to invest and to generate interventions that can tackle a preventive scenario, that can generate preventive scenarios for girls, and that will be specific to their needs and what they really experience about substance use, and specifically for marijuana use. So yeah, that was the results of this study, and I want to thank you for your time and your patience.
Okay. Thank you very much. Question for you. How is marijuana used there in terms of, in the US, obviously we have a lot of smoked marijuana, but the vaping is occurring a lot, and using the concentrated forms of cannabis. And I know in many parts of the world, marijuana is often mixed with tobacco, which doesn't occur a lot in the US. I'm just wondering, what's the major form of use there?
So the major form is smoked marijuana. The survey itself assesses just for smoked marijuana. But we're talking about 2016, right? So now we have like evidence or reports, most qualitative of them, that they also they have marijuana through edibles. Now that the regulation changed in Ecuador, so there's more use of oils, but in a recreational way, not in a medicinal way. And also obviously polydrug use, that is marijuana with bazuco or cocaine paste base, and cigarettes.
Right.
Yep.
Right. Very good. Very, very nice, sophisticated piece of work. Congratulations.
Thank you so much.
Okay. Our next speaker is Martin Egwoji. Sorry, Martin. Who's a very long-time friend and participant in the NIDA programs. Welcome and hello. Martin is a former NIDA Humphrey Fellow and a Distinguished Humphrey Leadership Fellow from Nigeria. He is the founder and executive director of the Global Initiative on Substance Abuse, a non-governmental organization that coordinates training on the universal prevention curriculum in Nigeria, as well as substance abuse treatment, capacity building, and policy. And he's going to speak to us today about implementing and evaluating the universal prevention curriculum to promote capacity building among drug demand reduction practitioners in Nigeria. So, welcome, Mark.
Thank you very much, Steve, and good day, everyone. Thank you for joining us. There are gaps in knowledge and skills of addiction practitioners worldwide, and the development of the Universal Prevention Curriculum, that is UPC, is one of the efforts to address these gaps. So this study is the first report on the implementation of the Universal Prevention Curriculum to promote capacity building among drug demand reduction practitioners in Nigeria. The aims of the study were in 5 folds. One, to consider the feasibility of implementing the Universal Prevention Curriculum for substance use disorders among drug demand reduction practitioners in Nigeria. Determine whether training objectives were met. Determine whether the program was delivered as designed. Highlight the connections between Wenger's social learning theory of community of practice model and essential components of the implementation process. 5th and the last one, assess the trainer proficiency. 3 instruments were developed for this study. The pre-post knowledge assessment developed by UPC national trainers in Nigeria, post-training survey that included open-ended questions, and trainer proficiency. Participants were selected based on interest among drug demand reduction practitioners in Nigeria. And between March 2019 and March 2020, 202 practitioners participated in the 6-day training conducted in 10 cohorts. The results from Table 1 shows that participants cut across different fields, with education having the highest number of participants. And Table 2 shows that the difference between the pre and post-cost means shows about 6.5 and effect size of 2. And Table 3 shows that the evaluation of training modules, a minimum of 4.5 on a maximum scale of 5. And the trainers were rated minimum of 80% from the domains that were measured. So what can we conclude from this? Out of 494, that is 96%, out of 202, 194, representing 96%, participated in the training, or who participated in the training, completed both the pre and post-test survey. And the mean difference between baseline scores and those observed following training demonstrate objective gains in fundamental knowledge. And all participants agreed that the curriculum was implemented as designed, objectives met, and that the course is relevant to their practice. And all facilitators rank proficient, that is more than 76%, in subject knowledge, ability to engage participants in the learning process, and supervision of the training environment, time management, and demeanor. That shows how effective the training of trainers was for the facilitators. And the training also demonstrated the essential components of Wenger's community of practice model. So in conclusion, the practitioners in this study work in varied professional environments and come from locations that include diverse ethnic groups across Nigeria, with very different languages and traditions. And they all agreed, that they all agreed upon the relevance of the training, demonstrates the feasibility of implementing a standardized curriculum on substance use prevention in Nigeria. So these are my contacts. And once again, thank you for your attention. And it's a pleasure seeing you again, Steve, and my friends. Thank you.
Thank you, Martin. Could you comment just a bit on what the status of, what's the next step, or what's the how's the implementation of the UPC in Nigeria going in the future?
Thank you very much. Even as at the time we collected this data, the COVID pandemic has not come. So since then, we have moved on to online facilitation model, and we are also going to evaluate how effective that will be. And we also have a platform through which we monitor participants from this training to see how they are putting into practice the knowledge and the skills gained from this experience. And they also use the platform to share their experience, challenges, and way forward. Thank you, Steve.
Okay, thank you. Okay, all right, the final speaker this morning's panel is Dr. Salman Shehzad, who's another former NIDA Humphrey Fellow. He is currently associate professor at the Institute of Clinical Psychology in the University of Karachi, Pakistan. And the title of his presentation today is Urdu Translation and Psychometric Properties of Perceived Stigma of Substance Abuse Scale in Patients with Substance Use Disorders in Pakistan. So welcome, Salman.
Thank you so much, sir. And good to see you again.
Yes, you too.
Okay. Good evening, everybody. From here, from Pakistan, is good evening, but the rest of the world is due to the different timings. My topic of presentation, which is the Urdu translation and the psychometric properties of perceived stigma of substance abuse scale in patients with substance use disorder in Pakistan. So the objective of my study was to translate and adopt PSAS, perceived stigma of substance abuse scale, into Urdu language and to determine its psychometric properties. First of all, the translation process was taken. It was the forward and the backward translation. And the second phase was to conduct the study and to see the reliability and validity analysis of this perceived stigma of substance abuse scale. In this study, the total participants were 200 male patients with substance use disorder, and the mean age was 29 years. The measure that we used in this study was the consent form and the personal information from perceived stigma of substance abuse scale, and the self-esteem and a multidimensional perceived social. Multidimensional perceived social support scale, and all these scales were used in Urdu language. In the procedure, we obtained especially the approval from the ERB, and then the selection of the treatment centers. Especially it was the purpose of sampling technique we used, the informed consent we included, and the ethical considerations were followed, and the administration of all the measures and the statistic we applied in this study. The finding you can see, especially for the descriptive information of the study variable, you can see the highest education level of the participants was 10th grade, which was almost 82% of the participants were up to the 10th grade level. and regarding the type of the substance use here in Pakistan, in 2013, according to DC drug report, people were using the cannabis mostly, but unfortunately now the methamphetamine now enter into the market, and most people are using the methamphetamine too. But in this study, the heroin use was quite high, and again 39% of the participants used the heroin, and the second was which was the polydrug use, or the multiple drug use in here in Pakistan. And then it was the almost the most hash and the methamphetamine were almost at the same level, the 11%. So the findings of this study, you can see regarding the reliability analysis, the Cronbach alpha for PSAS was perceived stigma of substance abuse scale was 0.76, which is adequate when we can say this is a reliable tool to be used here in Pakistan with the Urdu speaking patient with substance use disorder. And the test retest reliability was significant at 0.01 level. And regarding the validity, you can see that a significant relationship with the self-esteem as well as the multidimensional perceived social support. Now, keeping in view these the findings, the preliminary findings, we can say those perceived with the stigma have a significant relationship with the self-esteem and a perceived social support in male patients with the substance use disorder. Regarding the discussion and implications, these findings have certain implications for the mental health experts, the substance use treatment, as well as for the prevention experts and the general physician too, in order to reduce the stigma and the discrimination, which ultimately be helpful to improve the mental health and the quality of life of these patients with substance use disorder, as well as their families. Regarding the prevention field, these and the treatment perspective, that these findings we can use to develop then certain evidence-based intervention for the prevention science. Again, the culturally sensitive, the practices we can design, which should be centered on the stigma reduction and to improve the mental health, including self-esteem and social support and the well-being of patients with substance use disorder. And you can see here in this study why I used the stigma, because here in Pakistan, the mental health patients have been discriminated. And again, if the person who has the mental health problem or the substance use problem, it doubled the stigma related to these issues. The people, even the family members, don't accept the person if they found that their family member, their loved one is using the drugs. So it is so painful for them. And due to these things—
5 minutes.
So thank you so much. Thank you. So this is the overall the findings of my study, and thank you so much for listening to me and for your patience. Thank you.
Okay. Yep. Thank you, Salman. So I'll ask you the question that I've been asking others: is that your in terms of the future, what is your immediate future plan? It's like you have this is fantastic groundwork for doing additional research going forward. And I'm just wondering if you have any specific plans, or you think you're going to just try to use the translational work to create the instruments and hope to get used in the future.
Yes, especially that we are planning here. This morning, I was in a meeting with the Azad Jammu and Kashmir, the president of Azad Jammu and Kashmir here in the Pakistan side. So we had some wonderful seminar and a meeting. So based on we need to develop certain interventions at the universal level. We need to deliver certain training courses at the university level, at the community level. And these are the programs we want to establish, especially for the anti-stigma related to the mental health and the substance use. And this, we can expand these studies, not only the translation, but also the expand these studies at the tertiary level hospitals. And even we want to train the especially LHVs, what we call lady health visitors and lady health workers. At the PHC level, primary health care professionals, they themselves, they are not immune to the stigma. They themselves stigmatize the patient with the substance use disorder, moralizing and all these things. We want to train those people too here, because in the SDGs, it is mentioned that we cannot treat the substance use problem separately. So mental health and the substance use problem and the general health issues, we need to incorporate all these things. So especially we have immediate plan, especially in the northern part of Pakistan, so to develop these things. And so further, especially we were working on the the family-based intervention, especially for the children who are suffering from substance use disorder, and those children who have been taken from the streets, and they have been traumatized and they have been stigmatized. So we are planning to conduct some studies, especially for the children and adolescents with the stigma related and mental health issues.
Very good. Very good. Thank you.
Thank you so much.
Okay. Despite the fact that I think we're spread across probably 15 time zones in this panel, we managed to all pull it together and actually come in, with a few minutes remaining in our time. So I want to thank everyone for keeping on time, for making extremely excellent, informative presentations very concisely. I think this is a kind of a model that I was wondering about if it would work. Had some concerns that it might not work well, but I think it worked fantastically well. I hope you all agree. And we have a minute or two if anyone has a comment or question that they would like to make. We can do so at this time. Otherwise, we can just bring the session to a close. Yes, Lisa.
So I want to say to the newer faces in our audience, you may have heard us talk about the Humphrey Fellowship Program, the Invest Fellowship Program. And if you are not familiar with the fellowship opportunities that are available, I recommend that you go to the NIDA International Program's website and look at the postdoctoral fellowship opportunities, the Humphrey Fellowship opportunities for mid-career, and as a possibility that see what might fit within your experience, that you might have the opportunity to spend a year or a couple years in the US as a postdoctoral fellowship or a year as a Humphrey Fellow. So I encourage you all to look at that. If you email or have questions, usually I'm the one that is responding to your email under the umbrella of the NIDA International Program. So Ahmad and Judith, Ada, and I don't want to miss anybody's names, but if you're interested in looking at that opportunity, please look at the website, send us an email to ask questions, and look at that possibility. Do not, I don't speak any other languages. I am only an English speaker, so I always am so impressed with the language abilities that you have. Never feel worried about your level of English when you're looking at these opportunities. And don't let that be something that would hold you back, because I notice everybody has that strong skill. So I just wanted to make that a point. So look at our fellowship opportunities.
Yeah, and that absolutely. Thank you, Lisa. And also for your, not only for yourself, but for your colleagues. We like to think that all the friends of NIDA International are good recruiters for our fellowship programs around the world. So keep it in mind as you, in your course of your professional duties in your research. I want to again thank everybody very, very much. And hopefully we'll be able to meet in person next year.